Hello, my name is Arthur Lowry, and I'm the founder and CEO of Amazing Care Home Health Services. I am putting this video together just for you, the client of Amazing Care, to address the current pandemic of coronavirus or COVID-19. First, I want you to know that we are taking this very seriously, and keeping you safe is the top priority that we have during this pandemic. So know that we are working with our employees to make sure that they have the latest information that's put out by the CDC as well as the local Colorado Health Department. We train for these kind of things. We have an emergency preparedness policy. We really work hard. We know something like this is coming, and so we want to make sure that we're on top of it when it does finally hit our doorstep. So that being said, I think it's important that you know that right now there are no current employees nor clients who have tested positive for COVID-19. So in the population that we serve and those members of Amazing Care who are serving them, there is no current exposure that we know of. So that having your nurse come out or CNA or therapist come out should not put you at additional risk. If something changes, if we have an employee test positive or that client test positive, we have protocols in place to make sure that that exposure does not end up getting passed on to a new client. So it's important that you understand there are safeguards in place, and we will follow those safeguards to keep you safe. A couple of things you can do at home, right, to make sure that you're safe. Hand washing is probably the most important piece that you can do. If you're having other family members or other members of the community coming to your home, you want to make sure that they're washing their hands, that you're washing your hands. And then if you have antiseptic wipes, wiping down areas they may touch to make sure that we keep your environment as clean as possible. Other things to note, that if you have concerns, address those concerns with one of your staff members. You're welcome to ask for their supervisor. You're welcome to call and speak to any of the supervisors or directors of nursing at the branch level. If you have specific questions, they're happy to answer your questions and address any of your concerns. Also, you can reach out to Sonia, who is our Director of Clinical Services, or Catherine, who is our Administrator, and they would be happy to help you as well. And once again, if you don't get answers from them, you're more than welcome to call me, and I'm happy to address anything you may have. So most importantly, just know that we're going to keep you safe. We're going to make sure that we don't put any undue risk in your home. And bear with us. I don't think this is something that's going to last. I've heard people talk about lasting years. I think this is a situation we will see for the coming months, and it can be very scary. And I don't blame for people to be concerned, but I don't think this is something that's going to impact most of you. And we're going to do everything we can to minimize that possibility. So once again, thank you for being a client. And know that our mission is dedicated to serving you and to keeping you safe. Thank you.